Hello and welcome to my YouTube channel. I'll be speaking to you today concerning a topic called tuberculosis, or TB for short. Tuberculosis is caused by an organism called Mycobacterium tuberculosis, and that is an aerobe. I'll say something about that as we move along. It's an aerobe. What's really crucial about this condition called tuberculosis is the stigmatization that occurs with the condition. And why is there stigmatization? Number one, because of the association with HIV. Of course, not all patients that have tuberculosis have HIV. Poverty, substance misuse, homelessness, being in prison, and being a refugee. In other words, some conditions, some very peculiar situations can predispose patients to having tuberculosis. And so, in the mindset of some people, it appears that this condition is for certain types of people and not for other types of people. And so that brings about stigmatization. It's important to mention that a very large number of people around the world have tuberculosis. But having tuberculosis is not the same thing as being diagnosed with active tuberculosis. So, on one hand, you could have be infected with tuberculosis but not have overt manifestations. The reason why that happens is that if you are immunocompetent, in other words, your immune system is functioning properly, you will be able to contain the infection and not manifest symptoms. However, if there is a problem with the immune system, for example, if there is an immunodeficient state like in HIV, or an immunocompromised state as in aging as we get older, or there is immunosuppression as in patients that are, say, on cancer chemotherapy, or on disease-modifying anti-rheumatic drugs, or on steroids, these infection, which may be in the dormant state, can now progress and become active tuberculosis. So, on one hand, many people have the infection, but on the other hand, not everybody that has the infection is manifesting active tuberculosis. So we can classify this very broadly into latent tuberculosis, TB, or active TB. And so if you have TB in your body but have no symptoms, you'll be said to have latent tuberculosis. If you have TB in your body and you have symptoms, you'll be said to have active tuberculosis. So latent on one side and then active tuberculosis on the other side. How do patients contract this condition? Basically by transmission via inhalation. So if you come in close contact with the patient that's got tuberculosis, when the patient coughs, that sputum that is produced can contain, or when the patient coughs out, droplets containing the bacteria, Mycobacterium tuberculosis, can be released. And if you inhale that into your system, and for one reason or the other, there's a problem with your immunocompetence, you could actually develop tuberculosis. And remember, I said that tuberculosis caused by Mycobacterium tuberculosis is an aerobe. Being an aerobe means that it thrives, requires an oxygenated environment to grow. And so where do you think in the body will be quite oxygenated? Of course, the lungs, and the upper part of the lungs for that matter. And so the droplet containing the bacteria finds its way into the lungs and causes the infection. Broadly speaking, again, we can divide tuberculosis into pulmonary tuberculosis and extrapulmonary tuberculosis. So pulmonary tuberculosis is tuberculosis occurring in the lungs. Extrapulmonary tuberculosis is tuberculosis occurring outside the lungs. And so outside the lungs could mean tuberculosis affecting the kidneys, the brain, or the membranes of the brain called the meninges, the vertebrae, that's the bones of the spine. When it occurs there, we call it Pott's disease. It could also affect the adrenal glands. These are small structures on the kidneys, adrenal glands. And when that occurs, it causes a condition called adrenal Addison's disease. And then it could also affect the liver, causing hepatitis. It could affect the lymph nodes, causing lymphadenitis. Who are those at risk of developing tuberculosis? Number one, those that are close contacts with patients that have tuberculosis. I've already explained how the droplets contain this organism, and by inhalation, you can become a patient or develop the disease. Number two, if you live in an area where tuberculosis is endemic. Number three, if for any reason your immune system is weakened from HIV to being a kidney transplant patient or to be on chemotherapy. Patients that are under 5 years of age, those that are living in overcrowded and unhealthy conditions, such as people in prisons or those that are homeless, smokers, alcoholics, IV drug users, those that eat inadequately, and those that have been improperly treated with tuberculosis in the past, for tuberculosis in the past. What are the symptoms? The symptoms would be dependent on the organ that is affected. The lungs, in other words, pulmonary TB, is the most common type of tuberculosis. And so for the lungs, if it is pulmonary tuberculosis, we'll be talking about things like cough, usually lasting more than 3 weeks. And so we're dealing with prolonged cough in this instance. Number two, sputum or production of phlegm. Hemoptysis, where there's blood in the sputum. Fever, fatigue, loss of appetite. Of course, when there's loss of appetite, the next thing is weight loss. Night sweats. You wake up in the morning or in the night as if your back, your shirt is soaked with sweat. Malaise. And then if it does affect the membranes of the brain, it could cause neck stiffness. And if it affects the lymph nodes, it could cause swelling in the glands. So how do we make a diagnosis of tuberculosis? Usually, based on the clinical features, sputum analysis, in other words, the phlegm that is produced can be stained for acid and alcohol fast bacilli, can be cultured, or PCR or polymerase chain reaction can be carried out to determine whether the patient has mycobacterial tuberculosis. Could also have a test called interferon gamma assay, and then a chest x-ray could be done. How do we treat? Of course, it depends on the type of tuberculosis. If it is latent tuberculosis where the patient has TB but no active clear-cut symptoms, you could treat using a single agent for about 3 to 6 months. However, if it is active tuberculosis, you will need to treat for 6 months with multiple medications. Initial 4 medications and thereafter 2 medications. Now, it's crucially important that patients that have tuberculosis take their medications as prescribed. The problem that arises for patients not being compliant to the medication is drug-resistant tuberculosis. This can really be difficult to treat. How can you prevent tuberculosis? Now, there is a vaccine that is given called BCG, typically will be given in areas where tuberculosis is endemic, and then adequate nutrition. The better you eat, the better your immunity, the better your immune system. And then the face mask to be worn by medical personnel. There's a special face mask to be worn by medical personnel looking after patients that have tuberculosis. And then chemoprophylaxis. Medications can be given to those that are being in close contact with patients that have tuberculosis. So tuberculosis is a medical condition that is caused by mycobacterial tuberculosis. Stigmatization is a big problem, but there are steps that we can take to ensure that we protect ourselves. If you've learned something, like, subscribe, and share.